Imagine a simple blood test that can reveal the health of your liver, kidneys, and even your overall nutrition. That's the power of the albumin blood test. A small sample, big answers. Albumin is a vital protein made by your liver, and it plays several important roles in the body. Not only does it help keep fluid from leaking out of your blood vessels, but it also acts as a transporter, carrying hormones, vitamins, and enzymes throughout your system. Because albumin is so central to these functions, measuring its level in your blood can provide key insights into your health. So, what exactly does an albumin blood test measure? Quite simply, it determines the amount of albumin circulating in your blood. This information can act as an early warning system for a range of medical conditions. Low levels of albumin, for example, may indicate that your liver or kidneys aren't working as they should, or that you're suffering from malnutrition or another underlying health issue. On the other hand, higher than normal levels might be a sign that your body is dehydrated. Why would a healthcare provider order this test? There are a few common scenarios. It might be part of a routine health checkup, included in a panel of blood tests that measure different liver enzymes and proteins. Alternatively, your provider may recommend an albumin test if you're showing symptoms that point to potential liver or kidney problems. These symptoms can include fatigue, swelling in the abdomen or legs, jaundice, loss of appetite, or changes in urine color and frequency. Sometimes people with certain kidney diseases don't display symptoms until the disease has progressed, which makes regular testing all the more important. The albumin test is straightforward. A small blood sample is drawn from a vein in your arm, usually in less than 5 minutes. There's minimal risk involved, perhaps a mild sting or slight bruising at the site of the needle, but most people feel fine almost immediately. Preparing for the test is easy. Unless your healthcare provider has ordered additional blood work that requires fasting, you won't need to do anything special ahead of time. It's important, however, to let your provider know about any medications you're taking, as some drugs can affect your albumin level. Once your results are in, what do they mean? An albumin blood test by itself doesn't diagnose a specific condition, but it does provide important clues. Lower than normal albumin levels could be a sign of liver disease, like cirrhosis, hepatitis, or fatty liver disease, or of kidney disease, where damaged kidneys allow albumin to pass into your urine. Malnutrition, chronic infections, digestive diseases such as Crohn's disease, or conditions that cause poor absorption of nutrients, extensive burns, and thyroid disorders can also lead to low albumin. Low levels can even occur if you haven't eaten for a day or two, or if you're pregnant. Higher than normal albumin levels are less common, and they usually point to dehydration. This can happen due to severe diarrhea or other illnesses that cause your body to lose more fluids than normal. Sometimes certain medications, like steroids, insulin, or hormone treatments, can also push your albumin levels higher. It's important to remember that while albumin is a valuable marker, your doctor will interpret the results in the context of other tests and your overall health. For instance, an albumin blood test may be part of a larger group of tests called a liver panel or a comprehensive metabolic panel, which look at multiple substances in your blood for a fuller picture of your health. If your results are outside the normal range, don't panic. Many factors, including temporary illness, medication, or even recent meals, can affect albumin levels. Only your healthcare provider can determine what your results mean for you specifically and whether further testing or treatment is needed. The albumin blood test is a powerful tool for monitoring chronic conditions. If you have a known liver or kidney disease, your doctor might use regular albumin tests to see how well your body is functioning and to gauge how well treatments are working. Since albumin levels often change before symptoms appear, the test can help catch problems early when they're easier to manage. In summary, the albumin blood test is a simple, low-risk procedure that offers critical information about your liver and kidney health, as well as your nutritional state. It's a routine part of many checkups and can be a lifesaver for catching disease before it progresses. If you're experiencing symptoms like swelling, fatigue, jaundice, or changes in appetite and urination, or if you have chronic health issues that affect your liver or kidneys, Talk to your healthcare provider about whether an albumin blood test is right for you. When it comes to your health, knowledge is power, and sometimes all it takes is a small vial of blood to unlock important answers. By understanding what the albumin blood test can reveal, you can take charge of your health and work with your provider to catch problems early, manage chronic conditions, and make informed decisions about your care. So, next time your doctor mentions an albumin test, you'll know exactly what it is, why it matters, and how this one simple test can give you insights into some of your body's most important functions. Stay informed, stay proactive, and remember, even the smallest test can make a big difference in your path to better health.